Hi everyone. How are you?
Good. How are you?
Yeah, really good, really good. That's great to be here. Let me know when everyone's ready.
Yeah. I'm good. Yeah, thank you.
Great. Hey, look, it's great to be here at Waitākere Hospital today, and can I just say a huge thank you to everyone here who works so incredibly hard, our doctors, our nurses, our healthcare professionals, who do an amazing job caring for patients here in West Auckland. It's also good to be here with Carlos Chung, Member of Parliament for Mount Roskill. We're today here to celebrate, the opening of cancer infusion services here at Waitākere Hospital starting on Wednesday. That is the first time that we've had cancer infusion services here in West Auckland. And that is meaning patients will be able to have their cancer treatment closer to home, not having to travel into the CBD. But it's also part of a government-wide, a country-wide rollout by this government as part of our new 33 new cancer medicines. We will have 14 new cancer infusion sites across the country and 14 which will have additional services provided. And so this is will make a huge difference for patients. And it will make a huge difference also for clinicians who'll be able to actually make sure those patients are be seen sooner and closer to home. We've already had some of those new services have already started operations. This one today, Waitākere, is opening starting this week, and there's further expansions across the country taking place over the next 2 years. So we're really excited about that. It's going to make a huge difference to cancer patients, as I said. And it's all part of the rollout of those new cancer medicines, which of course do mean more infusions are being required. And I think there's a 13% increase in cancer infusions just this year. So a great day, I think, for patients, a great day for clinicians, and also this is about making sure that patients can be seen closer to home. So look, happy to take any questions, and thank you once again for being here as part of this announcement.
How many people will benefit from the new treatments?
Well, there's around 33 new cancer medicines. That's going to require, I think, around 13,000 additional infusions each and every year. So that's a significant increase in the number of infusions that are going to be needed. And so that's going to be thousands of patients across the country who will be benefiting from these medicines as well as the infusions. But importantly, it's also about having these services provided closer to home. So here in Waitākere, patients requiring cancer infusions would have had to travel into Auckland Hospital in order to receive their infusion. From Wednesday, those services will now be able to be offered here for patients here in Waitākere. This is being expanded across the country with new and expanded services in towns such as Waipukurau, Golden Bay. We've got expanded services going into Manukau and South Auckland as well. And so this is about really bringing the cancer treatment closer to home. And with that, that'll support people being able to get easier access, faster access, which is part of our government's faster cancer treatment target, and also improve our treatment rates as well.
Have you had a chance to speak to any of those patients today?
Well, the patients start on Wednesday, so we just had the opportunity to look at the facilities being used by other patients receiving other types of infusions at the moment, but the patients we did speak to were very excited about the prospect that cancer patients will be able to have those treatments offered here in Waitākere from Wednesday. So they see the real opportunity that that's going to create. Of course, everyone knows someone who's been impacted by cancer, and everyone knows how important it is for those treatments to be provided as close to home as possible. So really exciting day for patients across the country.
Why has it taken so long for it to be rolled out, and have you got any other plans of things like this?
So this is all part of the government's investment in those new cancer medicines. Those cancer medicines are now being rolled out, the 33 additional cancer medicines. As I said, we've already had 14 new and expanded facilities. This is the next 14 out to 2028. As we expand those services, as they become available to patients. And a key part of that is recruiting the oncologists, the specialist nurses, the pharmacists, all of those additional staff as well. So Health New Zealand's rolling it out as quickly as possible, and that's certainly my expectation as Minister of Health. They continue to do so. Great. Any other questions? Excellent. Hey, well, thank you so much for being here. Really appreciate it. And have a great day. Thank you.
Thank you.
Thank you. Well done.
Cool.
Thank you.
Thank you.
Well done. Great work.
Looking forward for
Nice to see you again, Carlos.
another facility opening soon. So.
Yeah. My auntie just lived just across the road, and she had acute So she spent a lot of time in the city, but he's the type of a lot of infusions though.
Globally, is the real danger that now that this deal is signed, you don't actually get progress on some fundamental evidence of a sharing of decision making and indeed a sharing of revenue between Auckland Council and the government? And is that the greatest risk, that it does just end up being a bit of paper?
Well, it is definitely a risk.